My name is Professor Judy de Haan, and I am a laboratory head at the Baker Institute. At the Baker Institute, we focus on diabetic complications, and these are the micro and macrovascular complications that occur as a result of diabetes. We have had a particular interest in understanding the mechanisms that underpin these complications. So there's a very strong connection between diabetes and heart disease. The main reason for this is that patients who are diabetic will have elevated blood glucose levels, and the blood glucose in itself will trigger a number of events in the body. One needs to realize that obesity impacts diabetes, and then diabetes will have a role to play for hypertension, and the one just begets the other. And so, for example, the underpinning inflammation is probably a way to tackle all of these things, because if you can reduce the inflammation, you will improve outcomes for the diabetic patient. But by taking the diabetic drugs, it will cause weight loss, which will then reduce the inflammation, which then improves everything. So diabetic patients have a 2 to 4-fold risk of cardiovascular events. And so by understanding the mechanisms, we're hoping to design drugs that are specific for that population. And in particular, we looked at one naturally produced antioxidant enzyme, glutathione peroxidase 1, and showed that if we are lacking this enzyme, this drives cardiovascular complications. And then knowing that information allowed us to design or use a molecule which has a similar property to the natural antioxidant, and showed that by using that drug we were able to reverse these complications of diabetes. So for people to donate to the Baker Institute now, it's really critical, because we're at that point where we're starting to see returns. The drugs are coming through at a much quicker rate now than in the past, because we're starting to really understand the mechanisms, and by making those important discoveries, that's what leads to these breakthroughs. So it all comes down to support, and by having that support we can make those breakthroughs.